Hi, everyone, and welcome to another episode of Wellness Day, a podcast coming to you every Wednesday here from the Jehangir Wellness Center. My name is Kavas Jehangir, once again here from the lovely GWC studio. And today I've got Dr. Piyush Chaudhari. Now, at some point in everyone's life, you've had a flu, you've had a cold, you've had a cough. So today we're talking with Dr. Piyush about infectious diseases. Thank you so much for being here, Doc.
Thanks, my pleasure.
Infectious personality, and now we're talking about infectious diseases. So, as I said, everyone's had a cold or cough at some point in their life. So, let's get straight into it. I mean, when someone thinks about infectious disease, COVID is the big one that everyone is unfortunately been exposed to, or rather they know about, and stuff like that. So maybe we'll avoid COVID and talk about some of the other ones that people need to know about. So, what is the most common infectious disease that come across your table today?
Yeah, so actually, if we see more than common infections,
Okay.
it is the common cases that are referred to an infectious disease specialist, because common infections are supposed to be kind of well managed by our physicians as well.
Okay, yeah.
I mean, equally well.
Common. Yeah.
So, in those, of course, in a city like Pune, I think the commonest always every monsoon, year after year, are dengue, chikungunya, typhoid, and all those things.
Yeah.
But as
Even typhoid, huh?
yeah, it's fairly common.
Okay.
And I would say quite often delayed diagnosis and treatment is not very uncommon with
Yeah.
typhoid.
Okay.
Okay, and it's actually one of those rare things where you require antibiotics, apart from the ones in monsoon, of which almost 90% do not require any antibiotics.
Which,
But the common referrals, if we see in hospital setups, are for unexplained fevers. So the commonest reason for which any of my colleagues refers to me,
yeah.
or any infectious disease specialist for that matter, is for unexplained or undiagnosed fevers.
Okay.
Okay, and then that is something which is a very wide term.
Exactly.
I mean, it could range from any of the infections which were perhaps missed due to some or the other reason, or not doing appropriate test, or not having appropriate tests available at the previous setup, or whatever.
Right.
Or it could range to something which is little rare in terms of being an infection. It is rare, so it is not suspected in the first place. Or there could be things where infections have occurred because of patients some other underlying medical conditions.
Okay.
Like we have so many people with transplants and cancers and all who are surviving for 10, 15, 20 years and all.
Right.
So they do get some infections which normally you and me may not get when our immunity is normal.
Got it.
Okay.
So someone comes to you and there's one step deeper from the physician, so to speak.
Kind of.
Yeah.
Yeah.
Okay. Interesting. But, we were talking about the common, or rather these infectious diseases. Today we're starting to see trends, or people are starting to talk about trends like, for example, there's people getting persistent coughs,
Yeah.
or virals that are very strong
Yeah.
and stuff like that. What is your opinion on that? Are you seeing that particular trend
Yeah,
happening?
definitely. I mean,
and why is it happening?
Yeah, I mean, last few months, or maybe we can say last 3 or 4 years.
Yeah, exactly.
Definitely people with many of these allergic conditions or common flu-like viral conditions, that number has definitely gone up.
Yeah.
I think the major factors being increase in pollution, then construction activities going on.
Right.
In every part of the city, you have some construction or other going
A lot
on.
of people, I know we said we won't talk about COVID much, but a lot of people attribute this to post-COVID vaccines and so forth. What is your take on that?
Well, that I would say is only a partial truth.
Okay.
I mean, the post-COVID part is perhaps correct,
Right.
not the post-vaccine part.
Yeah.
I mean, let me be very clear about
Please,
it on this
please.
podcast,
Absolutely.
that it is perhaps the COVID which could have played something with our immunity or allergic tendencies and all that,
yeah.
not necessarily the vaccine.
Vaccine.
Because, I mean, avoiding vaccine for avoiding all these things is not really justified. That way.
Right. And I know that you were involved in one of the clinical trials for
Yes,
one of the main vaccines as well. So you know what you're talking about.
Yeah.
But coming back to the diseases, I mean, we talked about antibiotics.
Yes.
And that how actually it isn't required for a lot of the things that people take it for. And because of that, now diseases are becoming more resistant and so forth. So what is your take on that and how we should address that?
Yeah, so if we see very common infections, like now monsoon is around the corner, or perhaps already we are in pre-monsoon phase. So 90% plus infections which occur during monsoon are actually viral in etiology. And none of these virals, except when they are something like say H1N1,
Okay.
chicken pox, something which requires antivirals. none of the others require antibiotics.
Yeah.
Okay, so the common perceptions that I have 104, 103, 105 fever, so I need an antibiotic.
Yeah.
Or there is a greenish phlegm coming in my cough, so I need an antibiotic. Or I mean, these are all the common reasons that people tell. Even
Yeah.
I mean, not just patients, even doctors, nurses alike.
Hmm.
That I always get sinus after I get cold, so I should take antibiotic.
Yeah.
Okay, or the moment cough turns little yellowish or greenish, I should take antibiotics.
Yeah,
So
really.
all these are not actually required. And what happens is actually when we are exposed to such antibiotics for something very trivial like a common flu.
Yeah.
I'm not even talking of H1N1
Right.
swine flu.
Yeah.
So every time we are exposed to these antibiotics, there are some natural bacteria which are there as commensals in our gut.
In your gut, okay.
Yeah, in everyone's gut.
Yeah.
And who are, I mean, they are sitting there without harming us when we are in good health, but they are the ones who are going to cause problems when somebody is ill, someone's immunity is down, someone is lying in ICU for some other reason.
Okay.
These gut germs are the ones which play havoc. I mean, they are the ones which are commonest causes of urinary infections, bloodstream infections, sepsis in a critically ill patient.
Right.
Now, every time we pop up any of our antibiotics,
Yeah.
be it simple azithromycin or amoxiclav or whatever, we expose these bacteria also to that antibiotic.
Okay.
And as a result, the ones which are susceptible, they get killed off,
Uh-huh.
and only the one which are resistant, they are left behind. So that particular illness, which could have been a simple upper respiratory infection or a simple diarrhea, which would have even otherwise gone in 48 to 72
Yeah.
hours,
Huh.
we select out the resistant ones. So in future, maybe several months, years later, when the person gets infection because of these resistant bugs, we don't have options with the common antibiotics.
So effectively what you're saying is you're killing your own immunity. Or not killing, but you're affecting your own
modifying, we can say. Yeah.
Yeah. Oh, interesting. That's actually very good for people to know that you're actually doing potential more harm than
benefit.
when taking antibiotics for these kind of diseases at least. What are the most common kind of myths that people come to you for dengue or chikungunya? Or I've had both dengue and chikungunya, unfortunately. But like for example, someone will say have papaya when they've started getting dengue, or they suddenly start taking vitamin C every day when they have a cold or something like that. What are the most common ones that people come to you with, which are true, not true? Good for you, bad for you?
Yeah, so like if we start with dengue, which is fairly common, and chikungunya again almost equally common in last year or so, because the same kind of mosquitoes spread both of them.
Terrible.
Yeah, and it's very debilitating. I mean, the pains are quite troublesome.
Yeah.
So the commonest myths about dengue is like the funniest part I've come across is once there was a kind of a well-educated IT couple.
Okay.
This was during my days at Bangalore when I was doing post-graduation. Bangalore is more or less same like Pune, and we get almost similar kind of infections over there as well. So they had literally plotted each platelet value in a chart. And the guy panicked at night 12, in middle of the night, he calls me when I was on call. You come here. My platelets are dropping at this rate every hour. So by 4 a.m. it's going to be 0. So I'm going to die. So the commonest myth is that the platelet count is very important in dengue is itself a kind of a misconception.
Okay.
Because platelet is just one of the numbers when it comes to dengue.
You can't look at it in isolation.
Yeah, and everyone who gets dengue does have some variation in the platelet count. How much differs from patient to patient, and the way it drops, even without any activity, it will increase unless there are certain complications, which are again in less than 2 to 5% of patients with dengue.
Okay.
So that brings to the next part, whether everybody with dengue should have papaya leaves or take the juice with papaya leaf. I mean, it will be miserable to take that even when you are all ill and forget about taking it when you're not well, already feeling having a bad taste in mouth with fever and all.
Right.
So that's what I usually tell the patient that would you have tolerated papaya leaf or its juice when you were all right? Then the usual answer would be no, it's very pathetic in the taste. Yeah. So now people have come up with those pills with the papaya extract.
Correct.
So now again, the literature is mixed, whether it actually helps or not, or whether some chemical in the extract actually helps or not.
No, whether it's a placebo.
Exactly. It's more likely to be a placebo. Usually, see, in uncomplicated dengue, the natural course goes like first 2 3 days, they get all the symptoms, the severe headaches, the body pains, and high fevers and all. By fourth, fifth day, all these counts start dropping.
Yeah.
And actually, when counts drop slightly, we or the patients, both ways, we are quite okay. I mean, we are quite patient in the sense of with the platelet count. Around day 7, day 8, the count goes to lowest. By that time, fever would have already disappeared, and next couple of days it is going to increase naturally. But that is the time when the count is lowest and we panic, and that's when we try all these sort of things like papaya leaves, and then maybe even some that colostrum, the milk, and all those things. Yeah. So, and coincidentally, the point count increases is what I believe. And what the actually scientific literature also supports.
You're already over the hill.
So I mean, and same thing actually analogously happens with antibiotics as well. In most of the virals, it is typically the third or fourth day when people resort to taking antibiotics. But that is also the day in the natural course of illness that it is going to recover. And then that fits in our memory.
Exactly.
Last time my cold got better only after I popped up one azithromycin. So next time the person sneezes and he takes one.
That's a good thing for people to actually think about.
Yeah.
So coming back to the preventive side, what are things that we can do to keep our immunity strong, eating, exercising? What are the things that you would recommend, particularly from the immunity standpoint for infectious diseases?
So building the immunity, the most important thing I think which many people these days in current lifestyles of theirs don't get is 7 to 8 hours of peaceful sleep.
So that's your number one thing.
Yeah, that's the number one thing, because sleep helps in so many things. I mean,
Restore.
it helps our body recover from the wear and tear that we go through every day.
Yeah, absolutely.
And then for peaceful sleep, then there are other collateral things like you should mind should be fresh and relaxed when by the bedtime. No gadgets after 8 or 9 p.m. in the night.
Yeah.
When actually we do see a lot of television and all that stuff. Then healthy meal, of course.
Right.
There again, I mean, in our typical Indian meal, if we see, then the protein and fibers are relatively low compared to the carbs and the fats.
Yeah.
So that is another thing which we can look at building up. Okay, so then adequate hydration. So this is something in general, irrespective of age or gender or other medical comorbidities. And then, of course, if somebody does have some medical comorbidities which put them at higher risk compared to others of that age group, then of course vaccination wherever possible for vaccine preventable diseases. So these are the preventive things in general lifestyle. And in day-to-day life, single most important action which can prevent most of the infections is proper hand hygiene.
Okay.
Yeah, I mean, just last week we had a very good program on hand hygiene, WHO hand hygiene week at Jehangir also.
Okay, yeah.
And
so just simple,
that
something
is one
as simple
simple
as
step. I mean,
washing your hands.
More and above, over and above all the masks, social distancing, more than anything else, simple act of washing hands prevents majority of infections.
Is washing hands better than sanitizer?
If soap and water is handy, yes.
Okay.
I mean, it should be washing hands preferable.
But otherwise, sanitizer is good.
Yeah, sanitizer is a good alternative.
Right. You talked about, you started talking about vaccines, Doc. But before I get into that, I'll just ask you, what do you do for your immunity as an expert?
Yeah. So the main thing is I love my sleep. So
okay, good.
That's
an important one.
Yeah, that's a very important one. Yeah.
That people don't really think about. So it really is something that people should
that's
be focusing.
That's something we all tend to neglect a lot when we are in our 20s, 30s and all. I mean, all of us can very well have night till 3 a.m., 4 a.m. and all. But once we start entering more into the 40s and 50s, then we start realizing the harms it has done to us of not sleeping in bed.
Yeah, and then the benefit of when you
benefit of going to bed at time.
Absolutely.
So that is one thing, and 35 to 40 minutes of exercise every day.
So what do you
preferably with muscle training as well.
Okay.
Yeah.
So what do you do for your exercise?
No, so most of the time it involves brisk walking and body weight exercise.
Right.
I mean, more than the gym, just
what
do we call calisthenics. Yeah.
Good.
I mean, less chance of injuries.
Yeah.
And I don't have to go to gym and all. Yeah.
Right. So coming back to vaccines then.
Yeah.
That's also an important aspect of preventive care. Definitely. So what are the kind of vaccines that one would recommend, especially as you said, the monsoon is coming up? What are the kind of vaccines that people should be taking from any age?
Yeah, so irrespective of age group, if we see, then flu vaccine is one which I think everybody should have access to and should take it.
Okay. And that you should take what, once a year or what is it?
Yeah, it's once a year, and preferable time is exactly this, somewhere around May and June, before the monsoon peaks and the flu cases peak. I mean, which in India and most of the places where flu is common, like Pune, Bangalore and all. So the peak season is somewhere between July to August, September.
Yeah.
And then second peak is during peak of winters. So unlike the United States, where they advise flu shots before every winter, we should be taking it in the end of summer actually. Yeah. And then ideally everybody should take.
Yeah.
But priority should be given to people who are above 65 years of age, or people who have comorbidities like diabetes, hypertension, or chronic lung, liver, kidney and heart diseases. And pregnant ladies, of course.
Right.
Because all of these, they should be taking. And what we use is an inactivated vaccine. So by itself, the vaccine doesn't cause any illness.
So you won't get sick when you take it?
Yeah.
Any vaccines that elders should be particularly to be taking beyond this?
Yes, of course. So people above 50 years of age, especially if they've had history of chickenpox as a child or as a youngster any time in their lifetime, they should be taking a shingles vaccine. Because it's a very sort of painful and troublesome disease. I mean, mortality wise, the rates are not very high, like your flu and COVID and other stuff. But morbidity and impact on quality of life is a lot. I mean, it's the post-herpetic neuralgia. Anybody who has suffered from it would tell us that it is one of the worst pains that the person could ever get. So anybody who is above 50 years of age, or anyone who has these previously discussed medical comorbidities, they should be taking shingles vaccine, 2 shots. And for rest of their life, they would be protected more than 90%.
So just one. You take it
2 shots,
2 shots, and then
once
rest
in
of
their
your life.
lifetime.
Okay.
That is one. And then others are, of course, vaccines against bacterial pneumonia.
Right.
So there are two types.
That's important.
That's another important one.
I mean, potentially very...
I mean, technically, if we see, if someone has covered flu, COVID and bacterial pneumonia, then
they're fairly covered.
75 to 80% of lung infections, which is world over the commonest reason for hospitalization amongst infections. So that would be taken care of just with these 3 things.
Okay. And what about the other end then? If you're a child or adolescent?
Yeah, even during childhood, the pneumococcal vaccines and flu shots are very much recommended. Adolescents, the important part, especially with females and now also approved in males, is a HPV vaccination. So what we commonly call as
males?
Even in males, because the cervical cancer vaccine, as it is commonly called, it's against the subtypes of HPV, which are commonly associated with cervical cancers. But along with that, much more commonly, it is also associated with genital warts, anal warts, sometimes oral warts, and penile and anal ulcers in males. Okay, so these things are also equally common as cervical cancer. Okay, and the vaccine contains the strains. The recent one, which is 9 nonavalent vaccine. So that one covers almost 91% of strains which prevent cervical cancer. And to give a perspective, that is the second commonest cancer a woman can have. Yeah, right. So, I mean, almost 90% of cases of that can be prevented with this vaccine. Okay, very interesting, doctor. We've covered all aspects from preventive to, treatment as well. Any last words that you'd like to leave us with? Yeah, so I think the most important thing I would like to highlight about 2 parts. One is please avoid antibiotics. Routine illnesses, routine fevers and colds, so that they are there to help you when you are actually needing it, quite sick and lying in some ICU with some critical illness. Sorry to interrupt, but it's actually becoming an epidemic in itself. Yes, of course. And there is so much about antimicrobial resistance everywhere, media and social media everywhere. Right. That even common people are aware of AMR. But what we are not aware of is we are ourselves generating most of the resistance in the community. Don't just pop pills. Yes. And second important thing is, please don't be scared of getting vaccinated. I mean, vaccine is not going to cause the disease. And I mean, the other part of vaccine is the cost, of course, in our country perhaps, because it is not covered under any insurances. But definitely the cost of that shot of vaccination is far less than the cost of suffering that disease actually. So if we put it that way, then that cost is nothing. Absolutely. And the third one I'd like to add is a simple one, is what you talked about is hand hygiene. It's such an easy and nearly free thing to do. Absolutely. And it is something accessible to almost everyone. And potentially one of the most powerful things. Most powerful things. So yeah. I mean, it has stayed the test of time for several centuries. Exactly. Now. Absolutely. Thank you so much, Doc, for being here and giving us your insight on a very important aspect that
everyone, as I mentioned earlier, has been affected by it at some point in their life. So thank you so much for giving us those insights. Thank you.
Thanks.
Thank you all, and look forward to seeing you next week. But before you leave, do not forget to please hit the like and subscribe button right at the bottom here. Thank you.